It's open enrollment season, and with changes expected to the health insurance marketplace in the new year, many are weighing their options on coverage. KTIV's Nathan Price is in studio tonight. He spoke with a local health insurance agent to learn more. So Nathan, what's changing here?
Well, yeah, man, I spoke with Shannon Stewart, an agency owner of Health Market, who said those shopping for health insurance could see many changes. Congress didn't pass an extension of the health insurance subsidies under the Affordable Care Act, so those will expire at the end of the year. Stewart says that these changes can greatly impact what you pay out of pocket for health insurance. It'll create what some are calling a subsidy cliff.
For instance, if a couple in their upper 50s is making $84,000, they can receive $1,000 off their health insurance premium. But if they're making $85,000, they would owe that $12,000 back. So it used to where it would taper down to zero with the subsidies. Now it's more of a cliff.
Another change, Stewart says, people will have to consider is whether plans they have will be accepted at Unity Point Health, Sioux City downtown, which was Mercy One until Unity Point acquired it in September. This may mean some have to travel out of the area to see a specialist. With all the changes, experts say it can be hard to keep up. Stewart suggests your best option is to turn to local experts with any questions you may have.
So you're going to want to talk to a local agent so that they can tell you exactly what their circumstances are. And the local agents are all honest people, and they're going to tell you exactly what you need and the type of coverage that you had, and also let you know the risk that you're taking by taking or not taking different coverages.
Now, Stewart says there's still time to sign up for health insurance with coverage beginning the 1st of February. In studio, Nathan Price, KTIV News 4.